Hi everyone. Today in this video let us discuss clozapine and agranulocytosis. What is this drug clozapine? Clozapine is one of the antipsychotic which is classified as atypical antipsychotic. So this drug is a second generation antipsychotic compared with old generation neuroleptics. Even clozapine is introduced a long back, but still this drug is important in the therapy because clozapine can be used in the conditions like resistant schizophrenia. This drug can be used to treat schizophrenia, which is resistant to other antipsychotics and which can produce various symptoms like hallucinations, either auditory or visual hallucinations, where one can perceive either sound or light or any other object without its real presence. Another symptom is the delusions, where the people can have wrong judgment in identifying the things. Another symptom is the apathy, lack of initiation, decreased emotional response. All these are the negative symptoms of schizophrenia. Similarly, people may have social withdrawal, which bring more complications in their lifestyle. Among the antipsychotics, the old generation antipsychotics can mainly relieve positive symptoms, but they are not effective in treating apathy and social withdrawal. New generation antipsychotics can relieve both positive as well as negative symptoms, and among those antipsychotics, clozapine can be used to treat refractory schizophrenia, where other antipsychotics are not able to control these symptoms, but still clozapine can control. In such conditions, this drug can be given. Similarly, this drug can also be used to control the suicidal behavior, particularly observed in the patients with psychosis. So suicidal thoughts can be controlled by clozapine, and this drug can also be used in the conditions like schizoaffective disorder, where the psychotic symptoms can be coexist with depressive symptoms. So people may have low mood, lack of appetite, lack of sleep. All these symptoms may be associated with psychotic symptoms. Again, in such conditions, clozapine can be used. Even though with these clinical indications, still with use of clozapine before and during the therapy, blood test should be done in order to check eligibility of therapy, because clozapine can produce one of the condition, agranulocytosis. This drug can reduce the neutrophil count. That's why absolute neutrophil count should be checked before the therapy as well as during the therapy. And the absolute neutrophil count ANC may be decreased less than 500 per microliter. In such conditions, it can produce agranulocytosis, which is a serious condition. In such people, this drug should be avoided, and care should be taken while using this clozapine to check any development of agranulocytosis in the patients. This drug is available as tablets, and it can produce agranulocytosis within 18 months of the treatment. So within this 18 months, people may observe neutropenia, the decreased neutrophil count. But in few of the people, this neutropenia may be developed somewhat earlier. So regular blood tests should be done while using clozapine in order to assess any development of neutropenia in the people. With the development of agranulocytosis, few of the symptoms like fever, chills, headache, fatigue, weakness, rapid heartbeat, and rapid breathing can be observed. Even it can increase the risk of infections by decreased levels of WBC. If any of these symptoms are observed with use of clozapine, it may indicate any development of neutropenia and agranulocytosis. So in such conditions, again the blood test should be done in order to check the neutrophil counts. So what are the risk factors for development of agranulocytosis? Even this agranulocytosis is observed in all of the people. Few of the risk factors can further increase rate of induction. For instance, in the people with any previous history of moderate leukopenia with WC count around 2000 to 3000 per cubic mm, in such people the development of agranulocytosis is more pronounced. So before starting this therapy, any previous history of agranulocytosis or leukopenia should be thoroughly checked. In such people, this drug may be better avoided. Even it is not clearly observed, but still the risk of agranulocytosis is more pronounced in the women as well as in the elders. So what are maybe the risk factors? Use of clozapine may lead to development of agranulocytosis. That's why before initiation of the therapy, blood count should be done to check WBC count. The WBC should be greater than or equal to 3500 per cubic mm, and ANC absolute neutrophil count should be greater than or equal to 2000 per cubic mm. If these values are observed in the people, then clozapine can be used for therapy, and regular checking should be done up to 6 months, and after 6 months again checking should be done with more intervals. And during the therapy, if we observe any abnormal counts, such as when the WBC is in between 2000 to 3000 per cubic mm, or ANC in between 1000 to 1500 per cubic mm, then the therapy should be interrupted in order to restore WBC and ANC levels, and in order to avoid further development of agranulocytosis. But in those people when the WBC count is less than 2000 per cubic mm or ANC levels are less than 1000 per cubic mm, immediately the drug should be stopped, because these levels indicate that there is a development of severe agranulocytosis. In such conditions, clozapine should be discontinued and it should not be rechallenged, because the risk of agranulocytosis is more pronounced in those patients. Even the exact mechanism for the development of agranulocytosis is not clear, but metabolism of clozapine is important. This is the structure of clozapine. This is one of the dibenzodiazepine derivative. Here two benzene rings are attached with a diazepine ring, so it is a dibenzodiazepine. This clozapine can undergo metabolism within the liver, and this metabolic process is carried by cytochrome P450 system. Now when this clozapine enters into the liver, it can be converted into metabolites. One of the metabolite is the N-oxide metabolite, and another one is the N-dismethyl clozapine metabolite. This metabolite is formed by removal of methyl group on the piperazine ring. Both of these metabolites are inactive in nature and they cannot produce any toxicity. But another metabolic product that can be released from the clozapine is the nitrinium ion. This nitrinium ion is having the high reactivity and it can produce some toxicity, leading to the development of agranulocytosis. So within the structure of clozapine, we can observe the nitrogen ring within the heterocyclic ring system. This can be converted into one of the metabolite, nitrinium ion, where the positive charge is existing on the nitrogen. Because of this positive charge, it is highly reactive, and this metabolic conversion is mediated by cytochrome P450 system. Now once this nitrinium ion is formed, it can produce toxicity on the neutrophils, which can produce oxidative damage, leading to decreased neutrophil count. So this is the clozapine. This clozapine is going to be converted into clozapine nitrinium ion by metabolic process, and this can target the neutrophils. These clozapine nitrinium ions, because of high reactivity, they can bind with neutrophils, and within the neutrophils they can produce some oxidative damage. Thereby they can reduce the levels of ATP, as well as they can reduce the levels of glutathione. Glutathione is an antioxidant. When their levels are reduced, the oxidative damage is more pronounced in the neutrophils, and this oxidative damage may result in apoptosis of neutrophils. This loss of neutrophils may result in neutropenia, where the absolute neutrophil count may be less than 1000 per cubic mm. In such conditions, clozapine can produce severe agranulocytosis. The development of agranulocytosis may result in increased risk of infections and other hematological disorders. That's why clozapine is restricted only for the treatment of refractory schizophrenia, where all other antipsychotics are not effective in the treatment and treatment is somewhat resistant. In such conditions, clozapine can be used, but the benefits of clozapine should be checked with the risks produced by clozapine, because this drug can produce agranulocytosis as well as it can also induce seizures in the people. In this way, clozapine can induce the agranulocytosis, but still it is one of the powerful drug in the treatment of resistant schizophrenia. So that's all about this clozapine-induced agranulocytosis. Hope you like this video. If you really like this video, please subscribe to our channel, share this video with your friends, post your comment in the comment box. Thank you for watching this video.